my name's Adam Sorrell. I'm one of the second-year residents at Marshfield Medical Center, and here to talk about the thyroid today. This is Dr. Timothy.
Hello, fourth-year resident in Marshfield Medical Center.
And so I'll just talk a little bit about kind of the basics of the thyroid, and like I talked to you earlier, hopefully we can have a little bit of discussion about this and just kind of see where things go. Otherwise we can continue to talk a little bit. But so first of all, the thyroid gland is located just under your Adam's apple here in the neck. So if you've ever been to a doctor's appointment where they feel around your neck, have you swallow, they're typically feeling if they can feel any lumps or bumps in that gland. And there's a nerve that runs through it. It helps you with talking and swallowing. And so if you are having problems with your thyroid that are coming from something that's actually growing in the thyroid, that's some of the symptoms that you can get. Is you can actually get shortness of breath, cough, difficulty with speaking or swallowing. That's not the most typical thing that goes wrong with the thyroid, though. The most typical thing is your thyroid is kind of like your furnace in your body, and it regulates your temperature. And so if it's, I know you were talking about that earlier with the temperature and needing the fan, I was like, yeah, this is a good topic for today.
Should I be worried?
So, and so it kind of, if it's producing too much of the thyroid hormone, the T4 and T3 is what we call them in the medical field, you can feel that you're too warm all the time, or that things are kind of running too fast, sweating, maybe you're eating more than usual. Diarrhea is another thing that comes with it. And the opposite of that, which is actually more common, is something called hypothyroidism. Hypo means low, and then too little of the thyroid hormones can cause you to feel cold, can dry out your skin, can cause constipation and things. And I like to think of it as kind of like a furnace that regulates your temperature, because there's actually something that controls the thyroid, and that's called the pituitary. It's up in your brain. And that kind of acts as like the thermostat. So if you change something in the thermostat, it changes how the furnace is functioning, right? And I only bring that up because our lab tests that we have in the hospital is we typically figure out how the thermostat is talking to the furnace. And that tells us how the actual furnace is functioning. So, yeah, I don't know if there's anything you want to add from right away in the beginning here.
I think I think you covered everything. Yep.
So normally, like when you have a regular physical, you'll have the test, the T4.
They'll do the TSH, and so that's kind of how the thermostat's talking to the furnace. And so it tells us if you have too much TSH, that means you're actually low for your thyroid, because it's trying to overwork the thyroid gland itself to be able to produce enough of that T4 and T3 that I was talking about. So yeah, the TSH is sometimes the lab test that we get at the annual physical exams, or if there are some symptoms that we think might be related to the thyroid, that would be the first place to start, is to get that TSH level. Was there another part?
Find out through a blood test?
Yep, that's a blood test. Yep.
And if that's high or low, then we'd go to the next step, which would be the T4, and that would tell us if your levels are abnormal, and that can tell you if you have hypothyroidism or hyperthyroidism.
Well, it just, I know that I had a niece that just thought that she, for some, I don't know, I can't remember exactly why she thought she had a problem with her thyroid, but she didn't seem to, and of course this is just, through word of mouth, through my sister, but she actually had the surgery. I don't think it took too much so I mean, it must be pretty conclusive, the blood test that she had that. She didn't seem any different to me though.
Yeah.
I mean, wouldn't you really notice?
Yeah. Sometimes the effects can be quite subtle, and other times they're. Do you know if your niece had hypo? Was it low or was it high?
Boy, I don't know. And she lives in California. So, again, I just thought it was so funny that she could just kind of seem to have a few symptoms, go in and have the surgery. I thought it would be a little more serious than that before they would do the surgery. But again, I didn't know all the details, but I mean, wouldn't something, you don't really wanna have that surgery unless it's really, really
Well,
off?
And the thyroid it can have all sorts of different problems with it. If there's something that's noticed, it can be anywhere from what we call a benign cyst, just like a pocket full of fluid, and it can go all the way up to aggressive forms of cancer, and anything in between. And so if they saw something where they said, you know what, let's take care of it, they would just do that right away. There's a couple other lab tests that they would be able to look into that would kind of pinpoint them in that direction. There's a couple of scans that they can do that can also say, you know what, this should probably come out. And then after taking it out, we can give a medication that does what the thyroid does, and so that people feel kind of normal still, even without the thyroid gland itself.
So it'd be real important to keep on with that medication all the time.
It would be lifelong at that point. Sometimes a more difficult medication for people to take. You're supposed to take it an hour before you have anything in the morning. So no coffee, no breakfast. So you could be waking up earlier or pushing your morning routine back a little bit. But it needs that to maintain a good level in the body so it doesn't go too high, doesn't go too low. If that doesn't work, you could take it before bedtime actually, but usually we try the first thing in the morning because that's more what your body is used to kind of naturally.
So is waiting a half an hour not enough?
Yeah, so it does. Some people say half an hour, don't they? Yeah, so it depends on who you talk to. I think a half hour is probably fine and more realistic.
Yeah, 'cause my doctor said a minimum of a half an hour.
Yeah.
Hour if you can make it. Minimum of half an hour.
So both of you have had the surgery?
No,
I've not had surgery, I'm only on medication.
Oh, so there's medication before surgery,
Well,
so that's the way it...
It depends on. You want to take this?
It depends on what kind of thyroid problem you have. If your thyroid levels are just lower, then they would give you thyroid hormone to make it higher. If you've got some kind of problem where the thyroid needs to be removed, then you would be replenishing that lost thyroid with the hormone. So either way, you would need the thyroid hormone just for different reasons.
Like, what did you notice?
My TSH was high.
Oh, did you feel different?
No.
I had no energy, I was just bleh all the time.
And that's typically how patients would present.
Mhm.
Would be with like low energy, feeling kind of slowed down. I don't know if any of this happened, but sometimes patients say that they're gaining weight or their hair is falling out or their skin is really dry. And that would be like all indications of like a lower thyroid. And then the opposite would be like they're feeling revved up, like their heart's beating really fast and they're losing weight. They just seem like they can't stop going. That would be the higher one.
Maybe my niece had some of that. It just seemed like she was very young, to have, and she was just so concerned about it because there was some family history of that. But that doesn't necessarily mean anything either, does it?
As far as being young, or
Well, in the family history.
in the fam-
It does kind of run in the families.
Oh, does it?
Mhm.
And then it typically can sometimes present younger, especially with hyperthyroidism. I've seen the patients I've had in their late 20s, early 30s.
Hmm.
And then as you get older, you actually have a higher chance of having a nodule, and that's just our way of explaining it on exam. And then until we do further imaging studies, we don't know exactly what that'll be. But it's up to 40% of the population will actually have something you can feel on exam throughout their lifetime.
So what is that surgery like?
That's less of our expertise. But a lot of times they can either target, they'll do a scan that has some iodine in it because the thyroid uses iodine, and they can target kind of where that is, and they'll make a determination if they need to take out the thyroid first. And then if they do, they can either take out the whole gland or they can take out just part of it, depending on what they find. So, yeah, but I don't have many more details than that.
Yeah, because it just seemed like, I guess when thinking back on it, that she was diagnosed so quick and then zing, zing with the surgery and, now she's older and, I just don't hear that. I guess I was just really surprised that she would even want to go through that, but she was really concerned about it, that but she was only like in her 20s, I think. And I think it was the thing with the gaining weight, and I didn't think that she was. I thought she looked fine, but, I mean, they investigated pretty thoroughly, I'm sure, before they there's a lot of reasons to gain weight. And the temperature thing too, I'm not thinking it's my thyroid.
So I was placed on Thyroid in early April, 25 mics. In the end of April, they upped me to 50, and I have felt crappy ever since. Up until just recently now, things seem to be straightening out a little bit, but is that typical, that it takes kind of that long to get used to a higher dose?
Yeah, so you're saying that you were started at one dose and then your levels were a little bit higher and then they switched you to another dose?
Yeah.
Yeah, and I think it does take just a little bit longer for your body to acclimate to that new dose. Synthroid's it's a little bit longer acting than our other drugs. It stays in your system for a couple of days, and then when you think about how your body's like reacting to that, I would think that it'd be pretty reasonable to think that it would take a little bit longer to.
So like I was waking up with headaches every morning, insomnia, which is just now maybe getting a little better, diarrhea, nausea. So I was pretty miserable, but now it seems like maybe things are a little bit better. Plus I discovered Linodal.
Yeah, and so a lot of times it'll be like 6 weeks before we check levels again, just to make sure that it's had enough time to stabilize. But there are a lot of different things that can cause the thyroid level to kind of go up and down, even when you're on a stable dose. So, yeah, it's
Stress.
Yep, stress.
Stress is the biggest one.
Yep, anything that causes stress on the
I
body.
think at the time I also had low potassium and low magnesium levels, so I don't know if some of that came into play along with that or not. But those are better now too.
Were you eating and drinking okay?
Because I went,
Were you eating and drinking okay when all of that was going on?
yeah, well, with the nausea, I didn't have much of an appetite. I wasn't eating a lot, but now that's better. So, but I don't get hungry.
Right.
And if it's been 6 weeks, then you can always get that level rechecked and make sure that
Yeah.
dose is appropriate. Sometimes they'll even say, like, take this much at one day and then take a lesser dose on the next day and alternate days like that. There's different types of schedules for it.
And I suppose there's actually a lot of different medications, depends on your doctor what they give you, or,
That's kind of interesting. Is we typically just have the levothyroxine, the Synthroid, that we typically use. There are a couple other kind of more specialized formulations, but a lot of times that endocrinology, the specialists in this, would be the ones using that. So whether you've got low thyroid and we give you some supplementation for that, or if you have high thyroid and then there's been a surgery or something, we would actually use about the same medication.
That's been around a long time too.
It has, yeah.
And now that I think of it, with my niece, maybe she, I think her sister had the same thing, and she did but hers was, I know she thought that's why she was gaining weight, but she didn't really lose weight then when.
That was one good thing. I lost 10 pounds.
There's just going to be so many variables. I mean, for all that stuff, really.
yeah.
A lot of variables, and everybody's going to react differently. So.
And why were you doing that? Why was your
Low.
dosage? Oh, no, hypothermic.
So that's just the normal part of a panel that they do when you have a regular appointment, is it? Or because I know I've seen that when they give you the handout of what your blood work was, I've seen, it's always been mine has always been normal.
I think as women get older, isn't it more common for older women to develop?
I think think as we age, some of these pathologies are more common. Some of them, it's also more family history, so we see them in the younger population as well.
And as for getting a normal visit, it kind of depends who you're seeing and symptoms you've presented with before to them and that kind of thing. So some people I know get it even yearly, and other people kind of wait until they see a symptom develop and then say, okay, maybe we should check into the TSH. It's just a blood test that might be able to tell us more. So.
We check it more often if you do have a family history of thyroid problem.
Good to know.
Yeah.
Thank you.
Absolutely, that's what we're here
Good
for.
job. He's got to know a lot of stuff. Yeah, well, and especially because, it could be so many different things, So you got to know a lot about a lot. We can turn the fan off now, I'm fine.
So is that about what you had?
Yeah, the only other thing I was going to mention is just that as you age, also your TSH itself can go up a little bit. So sometimes there will be some more tests if you've had a normal thyroid, and then the TSH starts to creep up a little bit. But otherwise, yeah, is there anything that we want to make sure we hit on, or any further questions?
Tell me what the great thing is about getting older.
Get wiser, right?
You even start losing all that.
Well, thank you very much. Find out.
Yeah, you're welcome, and yeah, enjoy the day.